There's a lot of major changes going on right now in healthcare, and not just Obamacare. Here to talk about the changes in technology is Andrea Clark. She's the CEO of Health Revenue Assurance Holdings. Welcome, Andrea.
Thank you very much. I'm glad to be here.
All right. Here's what I know. The healthcare system is moving away from ICD-9 to ICD-10. What does that mean?
That means that medical data is 30 years old. So we are moving to a more granular system, which as October 1st, that has to be implemented. Otherwise, hospitals and physicians, their bills will be rejected, their claims will be suspended and denied, and it'll be financial Armageddon.
Yes. We don't want that.
No, we do not.
And will that affect the patients, first and foremostly?
It does not affect the patients, but in the overall scheme of this new data, it is going to help us predict quality of care, reduce the costs of healthcare, and hospitals and physicians will be more transparent with the data.
All right, and then what does Health Revenue Assurance Holdings, which is a microcap company,
yes.
What are you doing to combat this?
We are assisting our clients and our partners with technology, which means that we're pulling that data and putting it in a predictive financial module so that they can understand their costs and revenues from the old data to the new data.
And this is not really being pushed by Obamacare, but it's still a part of the greater move to have healthcare digitized, to bring it into the modern age, right?
Absolutely. With the meaningful use in the electronic medical record along with I-10, this is the initiative of Medicare, their healthcare of e-health, because the more electronic and the more data you have, the more you can pull that data in, create dashboards, and predict and model to include readmissions. There is that initiative right now in hospitals where they will be penalized if a patient is readmitted within 30 days. And the first year is 1% of their Medicare revenue. Next year in 2014, it's 2% and 3%. So we've got technology already working with hospitals there.
And does this mean that there's going to be new jobs added to the system to help with this changeover?
Absolutely. HRA trains and supplies hospitals with this workforce, this quality workforce that is going to be utilizing this data October 1st and 2014 and beyond. And there's going to be a drop in productivity, 70%. So that means we need more to do this work.
All right, and who else is doing this? It sounds fairly specialized to me. I'd never heard about it before. Mm-hmm. Now I know that this big changeover is coming. So who else is in this business?
There's other competitors in the business where they could be a staffing company who provides those individuals to assign the I-10 codes. Others are utilizing technology also, but what makes HRA different is we're both a technology and also a service firm that is wrapped around our subject matter expertise that is greater than 20 years old in the healthcare industry, which we are able to guide our partners, our clients, into this transition and beyond.
All right, thanks a lot, Andrea.
Thank you.
Thank you for watching The Street.